Good morning. Hello, my name is Jonathan Fritz. I'm the Chief Innovation Officer for Chime. It's my pleasure to welcome everyone to today's Chime Innovation Beyond the Edge. This is our final session for our second season, with this being our 22nd Innovation Beyond the Edge. We've heard from great thought leaders, including Heather Nelson, John Halamka, Ryan Smith, Dan Barchi, Sarah Vaezi, Tanya Townsend, Scott Powder, Mark Probst, Sarah Richardson, Shafiq Rab, and many others. All of those sessions are available on demand through the Chime website. Innovation Beyond the Edge is designed to share creative problem solving and highlight innovation successes implemented by your peers. I'm very excited to hear from an industry thought leader today, Fred Peet, the Chief Information Officer at Yuma Regional Medical Center. He's going to speak about Yuma's journey from quality to innovation, including their successful Innovation Day and Shark Tank Challenge. If you're listening live or on demand and you'd like to present in one of these sessions, please reach out to me directly. A special thank you to ClearSense and Nordic, our seasoned supporters. We know that you're incredibly busy at this time, and so we really appreciate you joining us today. So why is Chime presenting the Innovation Beyond the Edge series? Well, quite frankly, change presents challenges and problems, but it also presents opportunity for creative problem solving. And that's really what innovation is all about. We want to highlight creative problem solving and these innovation successes and share them with the Chime community. If you give me a moment here, I'm going to read through a little bit of boilerplate language so everyone has an understanding of how the program's going to work and what we've got in front of us. So before we get started, just a few details here. Our session will have 3 main parts. 1, presentation from our speaker. 2, Q&A with our speaker. And 3, optional virtual roundtable sessions of 4 to 6 people, so everyone can have a candid discussion on the topic presented. We'll have everyone muted during the session. Questions for Fred can be posed directly to me in the chat function during his presentation. I will ask the questions in the order they were received. Also, we are recording this presentation. This will be saved and stored on the Chime site, so you can go back and review any details once we finish. Discussions within the breakout rooms will not be recorded. The roundtable discussions are optional, but highly encouraged, so please stick around. If you have difficulty listening to the live audio stream through your computer speakers, keep in mind that you can connect to audio via phone. If you need help with that or any other technical detail, please use the chat window to send us your questions. And also, if you've called in, please make sure to ask us to merge your video and your audio. Lastly, by attending today's full session, the presentation and virtual roundtable discussions, you will earn 1 continuing education unit for CHCIO, CFCHE, and CHISL certifications. We will review the attendee list following this session and distribute CEUs accordingly. I'm really excited to hear from Fred this morning. Fred joined Yuma Regional Medical Center in 2006. He has been the Chief Information Officer since 2015. Prior to Yuma, Fred was an IT leader at the University of Washington Medicine for nearly 11 years. Fred is a Chime member and a certified healthcare CIO. With that, Fred, please take it away.
Thank you, Jonathan. Let me get started by sharing my screen, and we'll kick off this morning's presentation. All right, can everybody see that? Jonathan, you good? All right, good morning. Thank you for joining me. We'll take a little bit of time this morning and go through our journey. It's been several years in the making, and it will continue. COVID kind of set us back a year, but we certainly plan to continue this year. Okay. There we go, sorry. All right, Yuma, Arizona. We're set equidistance between San Diego and Phoenix. We're a sole community provider in the desert Southwest. We have 406 beds. We have had considerable growth in ambulatory and clinic services. We have several residency programs, family and community medicine for sure, and we've recently added a sports medicine program. And then we have a comprehensive cancer center in our community. A little bit about some statistics from our volumes. I'm not going to read through each of those, but suffice it to say, outpatient growth is one of our emerging areas here. Now, this is the problem that I want to share with you today, and some of the solutions that we put in place to resolve this issue. We have had a perception of quality problem amongst our employees, physicians, and the public. At the same time, we continue to earn national accreditations and awards for patient quality and safety. So we're scratching our heads, and I know it's a little bit difficult to read there, but 2016, 2017, our numbers just continue to fall. And we couldn't understand why. We kept asking ourselves, why does our community, why do our patients think that we provide poor quality? Our staff at the same time, we knew that they were doing a lot of quality work across the organization. and yet they continue to tell us we provide poor quality care. So a lot of the leaders in the organization came together and decided to identify a goal to improve the internal and external perceptions of quality. We had to do something.
Say, Fred, I'm sorry to interrupt, but if you're advancing the slides, we're not able to see the slides advancing.
Is that correct? I'm sorry. Let me see what's going on here. Yes, I am advancing them. Let me stop this for a second. Sorry about that, folks. Share the screen.
There we go. See the a new slide.
The overall quality goal.
Yes.
All right. Let's see if we can pick it up from here. So internally, we came together to find a goal. We needed to improve that external, internal perception of quality. We needed to leverage our success and create, those connective purposes and belief that every individual can contribute to quality in the organization. We understood that improving quality is going to make a difference for the people we serve, and improved quality of life. Okay. Now I'm having, I can't. There we go. Some of the key objectives that we identified, we had to develop and implement this internal promotion tactics so that we can engage our employees and improve that perception. We wanted to apply some analytics and insight to create an action plan for the organization, and then better understand how employees define this quality, and they want to deliver it in healthcare for our patients. Some of the key insights, and this was, I won't say revolutionary, but very eye-opening for us. Quality, we tend to think of quality in terms of numbers, pure metrics, right? Our door-to-balloon time, our readmission rates, all of those were fantastic numbers for our organization. Yet we kept getting this survey results that told us that the quality was poor. So we've identified this as being a very complex problem. It's very subjective. It's difficult to define. We found that individuals are defining from where they are, from where their team is at, from their own life experiences, even as patients. As a sole community provider, most of our staff and most of our providers are patients at one time or another, as are their family members. So when they don't have the right experience, then their perception of quality drops. Our quality, our journey to quality is to get better and better. It's not a destination. It will never stop for us, but we continue to try to do better. So we went out to the patients and we had to ask them, what does high quality care look like to you? Talk to us about that. Tell us what that means to you. So these are, I'm not going to read all of this, but I want you to maybe focus in on some of those highlighted areas. Not feeling rushed, right? Giving that extra attention to the patients. Being efficient, personalizing the care, slow down enough to plan, resolve, getting to know your patients on a first name basis. All of these things seem like you would do them normally, but these were the things that they weren't seeing. Here's a few more. Always making an effort to improve ourselves. Know that when you finish a day's work, you feel a sense of pride, a warm smile, empathetic ear. So we continue to take these messages from our staff and try to understand that's the definition of quality and how can we get there. So you take this word cloud and we asked, well, again, what words best describe high quality? The overwhelming word that came out was compassion. By showing compassion, you show good quality. But some of these other words, listening, empathy, safety, service, patience. All of those are what quality means to the staff, the providers, and ultimately our patients and our community. So we had to figure out a way, how do we get that translated, one, that we exercise those and then translate those into the perception of good quality, and that people feel that we're providing good quality. So we knew that we needed to be inclusive. We needed to meet people where they are. We had to spend time, more time in the hospital, on their units, celebrating small wins. We needed to create a sense of enthusiasm in the organization, create purpose and belief. We wanted to make sure that we recognized individuals and teams when they saw quality, when they exercised quality, and then create a platform that enabled and expected everyone to contribute to that quality for the greater good. And that's really where this journey takes us, is we had to create that platform and drive home that expectation. Some of the ingredients we found for success was that our strategy had to align with one of our most important goals, and that is to improve the perception of quality. We had to create ways for people to see it for themselves, right? We had to continue to message to the organization that these are the things we're doing that identify and show quality. Where we are not there yet, we have to create a belief that we're going to get there. We had to grab people's attention by using the element of surprise and emotion and connecting those two. And then above all, we had to make it fun. If it wasn't fun, exciting, they weren't going to participate, and we were going to be back where we started. So connecting our platform to the people. Our employees want to believe that the work they do matters. They want to help people, and they want to improve lives and truly make a difference. And we understood that going in. Our core message, we needed to define that abstract perception of quality and try to connect that to the emotions that people were feeling around it. But we needed to make it simple. You couldn't make it lengthy and complex. Again, connecting to the staff and our providers, we needed to pack a lot of meaning into it. It had to make sense to people, and they had to feel it. And then we had to allow them to personalize it, either individually or with their teams, and they needed to be able to show that and be rewarded for that. So we're not there yet, but we must create this belief and inspiration for those doing the work. So our program is We Believe in Quality, and that's an ongoing commitment to always improving. And we continue to use this slogan today. So how did we do this? How did we get started? And what does that We Believe in Quality look like? So putting it into action, we asked people to recognize the quality that was happening all around them. They were given a couple of boxes, very simple, easy to do. These boxes give to someone who's demonstrated a strong commitment to quality. They keep one, and then they were to identify someone else and recognize someone else who demonstrated that commitment to quality. Very simple, but it started to change the culture of the organization to say, look, I understand that what you're doing is quality. Then we started what we called monthly quality challenges. And I'm not going to go through a whole year's worth here, certainly, but I will show you a few. We put together this little crossword about our patient portal. Once they finished this, they were then able to submit it and get a certificate for a coffee. In October, flu shots, we made it a challenge across the organization. And those departments that had all of their employees get their flu shot, that department was then given some recognition for them and their staff. Very successful in terms of that. Add a little competition, made it go a long way. We would go around the organization and take these photos and then share them in a electronic newsletter that we put out every week called the Weekly Dose. And so that started to have people and staff understand that, one, we were recognizing them, we were recognizing their departments, and we were recognizing quality, and it engaged the staff in all of this. And then in November, we started passing out these cups, and inside those cups was a little ticket allowed them to go and get a coffee. But the thing that they had to do was that we gave them a cup, and then we gave them 3 additional cups, and they had to go and find quality and pay it forward, right? They had to go and recognize someone for the quality that they were providing in the organization. These small yet very effective tools to engage people and start to change the hearts and minds about quality. What did that look like to them? They didn't have to recognize it as a metric on a board, but something that someone did or some compassion that they showed. And this was the little beverage coupon that they were able to get and cash in. In December, they had team building activity. They were given these small kits, and they were able to recognize quality and build that into an ornament for each of the participants in the department. So something very, very simple, but again, a way of continuing to recognize quality. And every month for a year, we put these kits out there. Now let's talk about Innovation Day. This was one of the most exciting, fun, engaging activities I think I've done in a long time. Certainly at this organization, I've been here almost 15 years now. And it was a fantastic success, I must say. So Innovation Day, what is it? What did it do? It's an inclusive day of activities that was designed to engage and inspire. And when I say Innovation Day, it was actually lasted for 24 straight hours. Many of us were here for that entire time. That way, every shift was able to participate, and it honored and celebrated the successes and builds new collaborative connections. Again, always improving was part of our quality message. So one of the things that we participated in during that Innovation Day was called the Quality Improvement Hall of Fame. So we went out and we asked all the leaders in the organization to pull their staff together and identify the things that they had done either in their department or somewhere else within the organization that represented quality to them. And then to put that onto a board, much like you would with grand rounds. And over 200 projects were submitted in these 4 categories. It was pretty amazing, the quality that was going on in the organization. What happened as a result of this Hall of Fame was we had members of our board, members of our executive team, and members of the community actually participate in judging each of these 200 projects. So the staff that identified the project, documented what they did and their findings, were asked to present to these judges. And then they were judged and awards were handed out. And it was just a fantastic event. We've done it 2 years in a row now, and it's amazing. Here's some other activities. So we did the Quality Improvement Awards. We did hold a Shark Tank, which I'm gonna show you a picture of in a moment. We did live simulcasts. We did Prescription for Quality event. But again, this was 24 hours of innovation and problem solving, a lot of engagement. Everyone in the organization was engaged at some level in this innovation day. A lot of the ideas and things that came out of this, we then put into practice. So here's just some photos of some of the activities and events that were going on that day. The little bucket up there, that's a 5-gallon bucket. And we went out and bought hundreds of those from the Home Depot to create those prescription bottles. And then inside was an activity that folks participated in either with their teams back in their departments or in central areas in the organization. As you can see, a lot of it is meant to be fun, right? We didn't want to have this be sort of a static, another boring, you're mandatory, go sit in front of a presentation, but yet it was designed to engage people in their workplace and actually show them that quality is where we needed to be and what we were after. Now, our Shark Tank Challenge was pretty exciting. As you can see in the photo, we have board members and some of our executives, and they actually, that's part of the set, the Shark Tank set that was put up for them. We had members of our organization come and present their ideas in person in front of an audience in Shark Tank fashion. And I will tell you that first year that we did this, every single project that was presented was funded, and we've executed on those projects. So it's made a huge difference for us. And these were quality projects and quality ideas that were brought forth. And once we were able to fund those and put those into place, it really showed people that the organization was committed to this, and it was highly engaging and very effective. And we've done it twice now. In fact, one of the projects, I will tell you, a member of the audience who was a practicing physician actually stood up and offered to fund one of the ideas all by himself and cut a check that afternoon. So very exciting stuff, very engaging. And where did that get us? So you see our 2016 score, our 2017 score. We did not have a 2018 engagement survey, but in 2019, our scores went up. That's statistically significant increase. And again, we continue on this journey. We did not do a survey in FY20, and unfortunately, we did not get to have an innovation day. We continue to focus on quality in the organization. In 2021, at the end of summer, we plan on doing another innovation day. We may have to change how we execute on that because of the potential restrictions around the pandemic, but we will get through it, and we will continue to engage our staff in this quality journey. And so with that, I'll open it up to any questions.
Fred, thank you very much. Really appreciate it and enjoyed the presentation. I've got a couple of questions while folks that are attending send any they have in the chat function. But can you tell me a little bit more about, how you came up with the idea for the Innovation Day and who on your team and other teams, got involved with that and the planning?
Yeah, it was really an idea that came out of a roundtable discussion at the executive level, executive team level. We started looking at the data and were perplexed continually year after year about how we don't ever seem to be able to get a good quality score from our staff engagement survey. But knowing that we had done a lot and continued to focus on that, so we came up with the idea. Again, it was just a roundtable discussion, people kind of brainstorming and throwing out ideas. In fact, the Shark Tank, the prescription for quality, all of those monthly quality challenges all came out of those discussions.
Okay, excellent. And
pretty creative group.
That's outstanding. I mean, it sounds like you had engagement from a number of different team members and kind of thought leaders that are, in your organization to pull that together.
Yep.
You talked about a number of the ideas and things that came out of the Innovation Day and Shark Tank presentations that were put into practice. Maybe if you can talk about one or two a little bit more in depth, any particular examples that you might be able to share?
One of the very simple things that came out that I'll share is, we have a cancer center, and as part of that cancer center, we have a very robust volunteer group, and they, on behalf of the American Cancer Society, provide wigs and hair dressings and things like that for those staff who are undergoing treatment. One of the things that they do is they have to be able to print out instructions, follow-ups, all of that at their little, section of the cancer center. And they found that time and time again, they would always have issues with their printer, believe it or not. I mean, it's just as simple as that. And they came in front of the Shark Tank, and in a way it was sad to see, but they were pleading, can we please have a new printer? Can we get something that's functional, that works for us? And so we made that instant commitment to make that happen for them, right? And this group of volunteers couldn't be more appreciative of something that simple to a lot of us, but it meant so much to them. So that was one that just kind of sticks out in my mind because they were so very emotional about it. Another one is in our community, we are all leaders in the organization are encouraged to sit on boards within our community. And one of those happens to be around a child's, essentially a library and an activity center. And they were needing funds, to be honest with you. So, and this kind of goes beyond the walls of the hospital, honestly. But several of our leaders who sit on that board have children within our community and participate in that organization. And so they actually came to Shark Tank and presented and asked for additional funding to help not only continue to operate that organization, but move it into a larger facility so they could expand. And that again was immediately funded by the organization. So just a couple of examples. It didn't necessarily have to be around and focused in on the four walls of the organization, but the perception of quality within our community is also impacted.
Mm-hmm. Excellent. It's interesting you bring up what seems like a simple example of a malfunctioning printer, a printer that wasn't working appropriately. And, it's funny because one of our past Chime board chairs, Shafiq Rob, had a very similar situation when he was at Rush and solved that. And it had like a tremendous impact on the people that were, involved. And so it's just another story of, creatively solving a problem, a friction point that actually has a meaningful impact on those that are involved. So that's great.
If it's not resolved, the negative impact is huge. And that ongoing perception of you don't care, we can't get this fixed, you're not providing quality to our patients. And we needed to address that right away.
Mm-hmm. So, when you started the presentation, you mentioned COVID and, some setbacks. Obviously, many of our members and hospital organizations have had, setbacks as a result of COVID, but there's also been a tremendous amount of innovation that's come out of it, and looking at kind of breaking down some of the barriers or walls within kind of organizations. Is there anything that you can point to from the innovation days that may have helped your team members or helped others in your organization kind of overcome some friction points or problems during the COVID times, or immediately following the pandemic?
Not specifically from Innovation Day, but I can share with you some information or some things that we've done around our community vaccination clinic. That we have a county health department. We're isolated. We're 180 miles from Phoenix, which is the hub, and they're receiving the majority of vaccination and attention. But we have taken the responsibility, and the health department has asked us to take that responsibility and develop a community-based vaccination clinic. So we worked with the mayor, and we've taken over the Civic Center. We designed a vaccination clinic for the community, following, of course, the vaccination protocols. But we've distributed about 98% of the vaccine we've received, we've gotten in arms, and we're waiting weekly for more vaccine. We're administering way more, well, we have capacity to administer way more than we're receiving. So we're really trying to work to resolve that. Now, recently, we found out last week that we're going to be a vaccination hub, if you will. The National Guard is going to come and work with us, and have invited us to be a 7x24 vaccination clinic in the community. And so we'll partner with them to operationalize that. A large part of our staff are involved. And from my perspective, being in IT, we had a large part of establishing that vaccination clinic, in that we extended our network to the Civic Center. We've extended our EHR to that Civic Center. We've created the workflows and the processes within the EHR to make that as streamlined as we possibly could. From people arriving to that vaccination clinic, they're about 10 minutes away from getting that shot in their arm and sitting for 15 minutes, and they're out the door. So it's been absolutely fantastic. I think it's going to be recognized across certainly the state of Arizona as we move forward. So another example of quality that we continue to pursue, and our teamwork is just fantastic. We're kind of isolated out here, and not to say that that's the driver, but certainly we pull together.
Mm-hmm. And we're hearing, from many of our members about the activities that they're involved with, vaccination programs and the challenges that they're facing. I'm wondering if you can maybe dive in a little bit deeper about kind of the different team members and maybe cross-functional teams, interaction with other parts of your organization, other, details that you might be able to share that could be potentially helpful for your peers that are listening in.
Yeah, well, of course, from an executive level standpoint, the chief operating officer, chief medical officer, and chief nursing officer and I collaborate on a daily basis. Without them, I wouldn't be successful. And certainly their reliance on technology and willingness to work with us in IT, it's not an adversarial relationship where, in some places I've heard that does exist, but very collaborative. We have a COVID sort of task force meeting every week. Our volumes of COVID patients dictated that we have a disaster COVID call. We had that twice a day for 2 months, with every part of the organization being represented. So from that perspective, my teammates, my directors and staff work hand in hand with the clinical staff and the provider staff on a daily basis with respect to either delivering technology for meetings like this in terms of Zoom type activities, or at a clinical level where we're providing at the elbow support, the vaccination clinic. I have staff that are side by side with those nurses at those clinics every single day that those vaccinations are going on. We also have what we call a concierge service within the hospital. So my team, members of my team identify themselves as concierge on call, and they have phones that are specifically dedicated to those concierge calls and are responsive, within 5 minutes or less to anyone in the hospital who has an issue that's IT related or that can be resolved by IT staff. So they've come to rely on that, and that concierge type approach to service from my organization has worked tremendously. And we've been doing that for about 18 months now, and it's worked fantastic. Our service desk also relies on them and can tap into a concierge support person to resolve a problem almost immediately. So been great, been great.
Wonderful, wonderful. Thank you for sharing. Before we go into the breakout room sessions, I want to circle back on the Shark Tank presentations and that activity for a little bit. A lot of organizations have implemented these types of activities for innovation, reverse pitch contests, innovation tournaments, various other things. Can you maybe share a little bit about anything that surprised you, anything that you were kind of particularly, intrigued about that you heard? I know you shared one example about the doctor that was willing to fund an idea, but anything else that was particularly interesting or noteworthy that you think the folks on the call here would be interested to hear about?
Yeah, the thing that surprised me the most, and maybe it shouldn't have, but it certainly did, was the amount of passion that the staff brought to those presentations. I mean, there were people in the audience with tears in their eyes when they heard of the problems these folks were trying to solve, and they were not that complex. And that's moving, and it really gets to the heart. If you go back to that bubble sort of slide that I had, the word cloud, compassion was one of the biggest words in that word cloud, and those people, they brought emotion, they brought passion, a lot of compassion to that simple problem they were trying to get resolved. And you think about them having to kind of go through that emotional struggle every day when they come to work, but wanting to feel when they left work that they had done a great job that day, but they couldn't get this thing resolved. And so it gave them an outlet, a place to go to say, hey, listen to my problem and help me solve it, and we'll be all better off for it. And extremely moving, and you can't replicate that in a one-on-one situation. You just can't.
That's very touching. I mean, it also brings to mind just the empathy for what people are going through in their day-to-day, and trying to remove those friction points or help them remove them in order to make the organization better, to ultimately deliver better care for our patients.
Yeah, but if you don't have that forum to listen, a lot of times you get caught up in your own day-to-day activities, and you don't ever get to that point where they're feeling like they can express that to you and ask you to help them fix it. So it actually was enlightening to say, here's a forum, and let's make it fun. Let's not make it threatening or hostile. You can ask for money, and we're going to listen.
Mm-hmm.
And that was great, really great.
That's wonderful. Wow. That's amazing. Thank you very much for sharing that. Really
You bet.
appreciate it. We're going to go into breakout room sessions here in a couple minutes. I've got a few announcements, but thank you once again, Fred, for the presentation and telling us your story and the successes that you're having at UMA. Really appreciate it.
Thank you.
You're welcome. You're welcome. Thank you. So Chime Innovation is launching an emerging ventures program next month. If you're a hospital leader that's working with any digital health startups, we want to hear from you. Whether you've incubated a new venture, co-created with an outside partner, invested directly into the venture, or you're an early adopter, please message me directly, jfritz@chimecentral.org. We also have a couple of InnoCast presentations coming up in March. Just as a reminder, these are a little bit different presentation style where they're focused on a problem that was solved by a Chime member, provider organization in partnership with a startup. On Thursday, March 11th at 10 a.m. Eastern, Teresa Meadows, the SVP and CIO of Cook Children's, will be presenting with the CEO of Patient EXP. And then on Thursday, March 18th at 11 a.m. Eastern, Jeff Sturman, the SVP and CIO of Memorial Care Healthcare System, will be presenting with the CEO of Intelligent Observation. So please get those on your calendar and join us for those. Additionally, please register for our Chime 21 Spring Forum, which is April 14th and 15th. And we're also going to have a new Chime 21 Summer Executive Forum on June 16th and 17th, which will also include an innovation track that we're going to be broadcasting live from our Innovation Center at Intermountain Healthcare. Again, thank you to ClearSense and Nordic for being seasoned supporters for Innovation Beyond the Edge. And Fred, once again, really appreciate your time today. Thank you for sharing your story. And hopefully you can stick around and join one of the breakout rooms. So we're going to randomly assign attendees to breakout rooms. And when you see the button that says, please join breakout room on your screen, just select that. And then just participate in active discussion and introduce yourselves and just talk about the innovation efforts at your organization. And please continue into the breakout rooms till the end of the hour. We'll not join back into the main session. So thank you very much. Have a wonderful day and be well. Christy, can you put me